want to appreciate everyone for coming down here. As always, I do want to thank our frontline people that are out there every day keeping governments running, keeping our hospitals running, keeping our jails running, our safe street, our EMS and fire responding every day, and to everyone that's out there that's essential workers. And like I said, from our DGS workers to people getting our trash, to people filling in potholes and doing different things. Thank you, thank you, thank you for everything that you're doing. To our friends around the state of New York, around this great nation, we're thinking about you. To our families that are far away, especially during this week that we have going on now with everything. So, thank God, no one passed away last night. So that's the good news. You know, the other news we have is that we have now 300 positive cases of the coronavirus here in Albany County, with 340 people under mandatory quarantine and 57 people under precautionary quarantine. And yesterday there were 288 positive cases, 384 people under mandatory quarantine, and 72 people under precautionary. There are now 41 people being hospitalized, with the hospitalization rate just over 13.6% of those who have been tested positive. We have 15 adults in ICU. So as we continue to put the numbers out there and not knowing, how the rest of the week's going to go, and everything else, I do want to say again to the families, to the 8 people that we lost in these last couple of days, our hearts goes out to you, and we're still thinking about you. But how important it is to isolate yourself, to shut down in your own house and not to go out. Like I said, it might not just be about you, it's about everyone around you, and it's about keeping the spread down. So please continue to keep that social distance, cough into your arm, and continue to clean your hands all the time. So I do want to thank, a big shout out to Governor Cuomo and his leaders for everything that they're doing here, not just on a statewide level, but here in the Capital Region. I had the opportunity yesterday to walk around the new state site they're setting up for testing. They're going to be doing probably around 400 today for the next couple of days until they get it fully ramped up, and they'll be able to handle about 1,000 people. Again, we put the number out. Again, we talked about that. You have to go through your doctor, and you have to call that number, the 1-888-364-3065 number, to get a PIN. And without that PIN number, you're not going to get through the first element when you have to come in the first checkpoint. If you don't have that PIN number and it doesn't match up, they're going to divert you out another exit, and you're not even going to get close to the site. So keep that in mind. Again, it was a great opportunity to meet with the National Guard, the Army and Air Force, the Forest Rangers that are doing a great job setting this up. This is their 7th one. They're doing a great job running it. The SUNY Police Chief, the state troopers, and to the medical corps that was there, and to the people that were getting fit, tested, so they could get ready to get the test up and running. As we're speaking, they're opened up. They're seeing their first few people now, and they're going to go from there. So again, a huge shout out to Governor Cuomo, because this is something Liza and I have been talking about when they shut down 2 weeks ago. What would our true numbers be, and how can you map and track this? And how do you know how serious we're getting? Are we at that plateau, as the governor said yesterday? Did we plateau out? Did we see our peak? Did we not see our peak? And then again, I'm guessing, just based on the data that we had, based on what's going on around us, based on what's going on downstate, Westchester, New Rochelle, Orange County, Dutchess, Putnam, paying attention to what's going over in Rensselaer County, talking to my counterparts like Steve McLaughlin and other people, Tony Pacenti out in Utica, and seeing how it's hitting them. Because you are kind of powerless without knowing the amount of people that have tested positive, or the amount of people that have it, don't realize they have it, but might be spreading it, and you can look at them numbers and you can try to analyze. So this week is going to be a tale for us. Like I said, by the end of the week, we're either going to be up around 800 or close to 1,000, or we did plateau, but we don't know. We don't know. And I want to thank Dr. Whalen, her department there, who's ramped up for this. We'll be ramping up, obviously, because as the tests come in near the end of the week, because the people that are going today probably won't come back in the Thursday, Friday at the earliest, maybe Saturday, and just do the math and the numbers. And they're not all going to be Albany County residents. This is about Rensselaer County, Schenectady, Saratoga. This is about the capital region. So this is going to be people in our region that are going to be coming here to get tested. So again, I do want to thank the governor and his team for making this happen, because without the governor's office getting involved, we wouldn't be able to get the testing and the logistics set up. Because I can assure you, when you take an opportunity to walk through there, the logistics behind it is incredible. So again, thank you to the governor and everyone that's taking care of that. But again, I do want to thank Dr. Whalen and her team, and not just Dr. Whalen and her team, to all the departments that are here, from our HR department, from our DCYF, to our probation, to our DSS, that are continuing with these mass layoffs and people not having jobs, have to file claims. They have to go for unemployment. They might need assistance now. Even though we got that 90 days, no eviction, some people are struggling to put food on their table, and making sure that we're taking care of everyone. And most importantly, trying to keep all of our seniors home, our most vulnerable citizens and people with underlying health conditions home. So again, to everyone that's doing that, thank you so much. Thank you. Dr. Whalen.
Thank you, County Executive McCoy. So today's development of having the ability to do community testing is a real great shift for us. To date, we have not really been able to look at this from any meaningful epidemiologic perspective of knowing where we are in the curve. And this data that we look forward to getting in the next week is going to be really key for us to see where we are. So far, we've been looking at indicators like how the hospitals are doing, how our mortality rate is, and the percentage positive. So those that are tested, what percentage of them have been positive. And our percent positive has been around 7-8%. It hasn't been that high. If you look at the areas where there are widespread testing, where we know there are communities that are currently reaching their surge capacity in the hospitals, the percent positive is much more like 40 to 60%. So from those indicators, we could determine that it's unlikely that we've hit our peak in Albany County. But we'll get a lot more data this week, and one of the things that we're looking forward to do with the health department is being able to share some of that data with you. As we get more people tested, the data becomes more meaningful. We are able to get a better picture of where we are in the community. So we are working on creating a way to share that with you. Many of you know that the New York State Department of Health has also instituted a data platform called COVID Tracker, which does give this information, some county-specific information on the amount of people that have been tested, the percent positive, the death rates. But we're looking at trying to get some more in-depth data. What I will again share with the residents of Albany County is that the measures that we have discussed around infection control, staying home, utilizing rigorous hand sanitization and hand washing, social distancing, and respiratory and cough etiquette are more important now than they've ever been. The next 2 weeks are going to be very important for us as a county, and probably after that as well. But let's just focus on the next 2 weeks. The weather is getting nicer. People are more enticed to go outside. If you do go outside, make sure you maintain a distance of at least 6 feet. We know this virus is very contagious. We know that for every person infected, 2 people may become infected from them. The only way that we can change this is to continue the measures that we've discussed, to stay at home, to stay away from others, and to protect especially vulnerable populations. So going forward, this is going to continue to be essential. It is more important on a daily basis. So we encourage people to continue to practice these important infection control measures. We are hopeful that we will not be as hard hit as some of the downstate counties, but we don't know that yet. and we have to act like we're trying to avoid those situations. So please consider this and remember the importance going forward. Thank you.
Thank you, Dr. Whalen. This marks a religious time for Christians and Jews with the Holy Week, Passover and Easter. It's normal time for family and friends to come together in their places of worship to celebrate their beliefs. And now we can't do that. And some people struggle with that. You know, they like to be at the synagogue or the church. They like to be at their place of worship, to be with other people, to celebrate their beliefs. So we know it's been difficult. So I want to thank Rabbi Roy and Father Chris for both being here to give us some words of wisdom and to talk about the difference that's affecting stuff happening in the synagogue and the church. So Rabbi Roy, we're going to have you go first.
First of all, I'd like to thank County Executive McCoy and Dr. Whalen for all the work that they've been doing. I know that a month ago, before we even thought we'd be closing synagogues, we were in contact with Dr. Whalen's office on an almost daily basis to get updates as to what we should be doing. So thank you so much for all of your efforts. Passover has been a time for family gathering for thousands of years, literally thousands of years. And this Passover is going to be different. Normally we say, why is this night different from all other nights? Well, now we're saying, why is this Passover different from all other Passovers? And that is that we have to stay home. Many families are tempted to gather together, and young people are tempted to visit their parents. Older people are tempted to go visit their children for Passover, but the Jewish perspective is chamira sakanta meisura. That's Hebrew for danger to life overrides any ritual needs whatsoever. Even if it's only a possible saving of a life, that overrides any ritual needs whatsoever. And so in our synagogues all over Albany, we have been putting together guides for prayer so that people can follow the practices at home. We've been having Zoom and video classes. We've been checking in on the most vulnerable in our community. We've organized major volunteer efforts to help people shop at the supermarket, pick up their medicine and other supplies that they might need. We thank the Jewish Federation of Northeastern New York, as well as Jewish Family Services of Northeastern New York, for their efforts to help the most vulnerable in our communities as well. And finally, I'd like to thank Price Chopper for really putting together, making sure that all of the kosher for Passover foods that we need for Passover are available, and increasing their efforts at making prepared foods for those people who normally would be going away for Passover to their families. We have really urged everyone to stay home and save lives, and you might even be saving the lives of your own family by doing so. I'd like to just add one more thing. And that is, every time, or most of the times in which the Bible in Exodus and Leviticus mentions the temple, which represents our faith communities and communal observance of religion, it also mentions the Sabbath, almost in the same breath and certainly in the same paragraphs. And the Sabbath represents our observance of religion at home. And so we hope that everyone who is ill has a speedy and full recovery from this illness and from all illnesses. However, those of us who are now forced to remain at home, which we should do, have an opportunity to strengthen our faith observance at home, strengthen our connection to God and our connection to all of our family practices, to teach those of us blessed with children, to teach our children at home how to observe things at home, and what a Jewish or religious home looks like from that perspective. So we should look at this as an opportunity for that, even though, of course, we would rather all be together. Thank you.
Thank you, Rabbi, for them encouraging words. Father Chris?
I also want to thank Executive McCoy and Dr. Whalen for all that they have been doing and continue to do throughout this difficult time. I also want to thank Rabbi Feldman for his words of wisdom and his help to us to recognize this time that we're in and to see it in a spiritual perspective. From the Christian perspective, and we are also in the holiest week of our year, and this is the time when we come together for prayer, for support. We walk with Jesus Christ through his suffering and death to his resurrection. The early part of this week is going to be easy, and I think that because it so fits the time that we're in right now, and that is this time of pain and suffering. Jesus walked through the pain and suffering of his life and comes out on Easter Sunday. I think Easter Sunday is going to be the difficult day for Christians. I keep thinking of this time. This virus has invited us into a time where we need to see, as Rabbi Feldman said, that alone and with our immediate families, the places that we are living in, can be the place where we walk with Jesus through this week. The difficulty is that our Easter looks like it's going to be a little bit later than it was for Jesus. It doesn't look like it's going to come on Sunday. And so we need to, as Dr. Whalen has advised us, to remain vigilant and especially to keep watching these numbers and to pray to God that these numbers will soon reach their peak and start to slow the curve. This is a very difficult time, and as Rabbi Feldman's congregation, and I'm sure mosques and temples throughout the capital districts are doing, so we also are reaching out to our folk who are especially vulnerable, especially the elderly and those who live alone. We are doing that. We are doing our services on YouTube and video. We are trying to reach people in any way we can. But the essential nature of our service is to gather together, to be in communion with God and to be in communion with one another. And to not be able to do that in this holiest week is going to be very, very difficult. I know it's very difficult for me. I miss our congregation immensely. But it is our time now to fast from being together, to walk with Jesus through his suffering, and to look forward to that wonderful day of resurrection. It won't be this Sunday, but it will be for sure. That's the promise of the Lord. We wait together.
Thank you, Father. Thank you, Rabbi, for them inspirational words and how things have changed when it comes to worship, and things have changed here around us, and it's the new norm. So hopefully everyone's starting to get used to it, and again, taking that big step back, taking a deep breath, and evaluating the situation around them. I also want to thank Bill Cade, who donated 500 N95 masks to our county health department. Bill, thank you. He had them left over when he did a big purchase for Puerto Rico and Haiti a few years ago and found the boxes laying around, so thank you for that. I also want to thank Kenneth White's Army, who donated $250 to Burn Knox Westerlo School for food for kids to make sure they're getting fed up in the hill town, so thank you for that. And a little bit of update of news for the PVA at a Cohoes that are trying to get approved to build ventilators. It looks like they're going to receive federal approval within the next week, and they'll be expecting to take orders and shipments to go out by April the 24th, but we'll keep you updated when they get the final approval. But that's great news going forward to help out with everything. I also want to thank John Signer from OTB. He's letting us use his cable network channels to get out the message of what's going on. And thank you, John and OTB, for being a great partner here in the Capital Region and to making sure that we're getting the stuff out via Facebook and then on our TV channels. And the update, recorded, and posted are also on Facebook, albanycounty.com, being shown on Albany County Schenectady Public Access Channel. So thank you for all that. And I don't want to leave this out because this is what we talk about all the time, is the mental health support line that we set up. So please don't forget, that goes 7 days a week from 8 a.m. to 5 p.m. Don't be afraid to call. No one's going to judge you. And trust me, what you're thinking. I said this yesterday, what you're thinking about, other people are probably thinking. So call up and try to get the answer that you need or the help that you need to seek. But the number is 518-269-6634. And as always, the New York State hotline and the reverse 211 number, so people know that's out there. Again, I want to thank everyone that's been helping us keep us safe, everyone that's been a great citizen here in Albany County, that's staying home and doing what they need to do, and doing everything from their house by themselves. So thank you.